Welcome back to the Human Resource Academy channel, guys, with yet another educational video on some of the most important aspects of the human resource management discipline. We hope you enjoy it. In today's video, we are going to look at the most relevant and pertinent topics since the start of 2020, the coronavirus outbreak. As the new coronavirus continues to spread rapidly around the world and has already started taking its toll on society, it is extremely important that we discuss its impact on human resource management. Just as the global financial crisis in 2008 had a massive impact on HRM, we can already spot similar trends taking place due to the coronavirus outbreak. So whether you are currently employed or you are looking for a job, this video is very important to you because the information it provides will serve you well to go through these rather difficult and uncertain times. So without any further ado, let's get started, guys. First of all, let us distinguish several yet very important things. Now, whenever you listen to the TV or you're reading news related to the coronavirus, you would often realize that this thing, COVID-19 and the coronavirus, are being used interchangeably. Now, what is COVID-19? COVID-19, in fact, is the abbreviated term for the coronavirus disease. The virus, on the other hand, that causes COVID-19 is a novel strain of coronavirus belonging to the same family as other viruses that cause severe acute respiratory syndromes such as SARS and the Middle East respiratory syndrome MERS. In simple English, the virus attacks our lungs and often causes distinctive pattern of pneumonia. That being said, let us look at some of the most common symptoms caused by the coronavirus. Fever, cough, shortness of breath. In fact, a few days ago, another research center came up with the 10 most common symptoms of the coronavirus, and fever, dry cough, and fatigue actually are in the top three. Many experts, in fact, say that one of the easiest way to distinguish between a regular seasonal flu and the coronavirus is the so-called dry cough and chest pain. Of course, this is not a video focusing on the prevention of the spread of the coronavirus, but if you are watching this video now and you have any of these symptoms, please contact the local hotline or report to the nearest hospital in your town, district, or county. Be a responsible citizen. Next, let us look at how it all started. It is believed that the coronavirus outbreak began at a wild animal market in the city of Wuhan, which has a population of approximately 11 million people and is also the capital of Hubei province. By the way, Wuhan is also one of the main manufacturing hubs in China. So on 29th of December last year, the first case of an epidemic respiratory infection caused by a new strain of coronavirus was announced by the Chinese government. The first cases of COVID-19 outside China were identified in Thailand on January 13th and 3 days later in Japan on January 16th. By the evening of January 20th, there were already 4 confirmed cases outside mainland China, 1 in Japan, 1 in South Korea, and 2 in Thailand. At the same time, there were also a number of suspected cases in countries such as Vietnam, Singapore, and Hong Kong. A month later, unfortunately, the virus had already reached the shores of other continents, including North and South America, Europe, and Australia. So by 22nd of February 2020, the number of confirmed cases in mainland China was already above 76,000, and there were over 1,500 confirmed cases outside mainland China. While South Korea was the second most affected country after China up until the end of February, since early March, Italy has had more cases of Covid-19 and more deaths than anywhere outside of China. In fact, if we take into consideration the fact that Italy's population is more than 22 times smaller than that of China, we can conclude without a shadow of a doubt that Italy is in fact the most affected country in the world. Remember, percentages are much, much more important than numbers. Thus, after following closely for over a month the latest developments with reference to the coronavirus outbreak, finally on March 13th, last Friday, the World Health Organization declared the new coronavirus outbreak a pandemic. Since then, a number of governments around the world have decided to put their country's inhabitants under lockdown. For instance, Spain, the Czech Republic, Denmark, and even countries in Asia such as Vietnam and Cambodia. In the following days, it is expected that many more governments around the world will follow suit. Given these unprecedented measures, various national and international events, including concerts, expos, sports games, and so forth, have been cancelled or suspended. Moreover, many businesses have been forced to shut down their operations until further notice. At the same time, there are a number of sectors that have seen a dramatic increase in demand for their services. Unfortunately, those who are working at the forefront of the fight against the coronavirus outbreak, doctors, nurses, and other medical staff, are risking their lives in a quest for saving others. The nature of the job puts healthcare workers at an increased risk. As one Italian doctor working at an intensive care unit in Bergamo reported, the war has literally exploded and battles are uninterrupted day and night. Depending on the industry you are working in, as well as your profession, you may be lucky enough to enjoy working from home these days. Companies such as Google, Microsoft, Twitter, Apple, Salesforce, and their likes have in recent days rolled out mandatory work from home policies aimed at the spread of COVID-19. Unfortunately, however, not all professions and companies allow for home office. For instance, airlines, hotels, and even factories have no choice but to force their workers take a leave. Now, for those of you who are not familiar with the types of leave you can get, there are two main types, paid and unpaid leave. Now, in case of paid leave, you would normally receive a percentage of or your full monthly salary for a definite period of time. To find out, however, whether you're entitled for a paid leave, you must check either your employment contract or directly consult with your employer. Unfortunately, even if you have been or can be granted a paid leave, this employment benefit will not last for long. In case you're one of those people who didn't have a job until recently and now you have been offered a job, first of all, congratulations. While this is usually great news, there is one thing that you might need to take into consideration before you start making any further plans. Specifically, many people who have recently been offered a job forget or underestimate one very important factor: the need to submit a medical certificate prior to starting their job. Now, while obtaining a medical certificate is considered a relatively simple procedure, this perception has been largely challenged by the coronavirus outbreak in recent days. Specifically, besides the regular medical test, including blood and urine tests that you are required to take, many companies are now, amid the coronavirus outbreak, asking for an additional test, a so-called Covid-19 test. Moreover, considering how easily Covid-19 spreads, as of now, one of the places that you should not visit unless it is extremely necessary is hospitals, especially if these establishments are treating patients with the coronavirus. I personally know of people who have already turned down job offers because they were asked to test themselves for the coronavirus and they were simply panicked or afraid to pay a visit to their nearest hospital. Last but not least, let us say a couple of words to those who are still job hunting. Maybe you're one of those guys who, since the start of 2020, has decided or has been thinking about changing your current job. Maybe you believe that you are being underpaid. Maybe you find your job rather boring, or yet you have been waiting for way too long for the promotion that you believe you deserve. The big question, however, is it now a good time for job hunting? By all means, it isn't. In fact, it is probably the worst time to be looking for a job now. Why? Well, as more and more businesses are expected to suspend their operations in the coming weeks, recruitment and selection, two of the main functions of HRM, will be put on hold for some time. Moreover, the economic consequences yielded by the coronavirus outbreak are already revealing an even more disturbing trend. The entire global economy, except for several sectors, has been hit really hard by the outbreak. For instance, Nasdaq has lost more than 20% of its value in less than a month. On Thursday alone, March 12th, we witnessed the worst day on the stock market since 1987 as Dow plunged almost 10%. Overall, some of the most severely affected industries include the travel industry, hospitality and tourism, as well as the energy industry. Just to give you an example, in less than a month, the shares of some of the most renowned companies around the world, including Ryanair, Booking, Expedia, Delta Airlines, Uber, and its main competitor Lyft, have plummeted by more than 50%. This, of course, means one thing and one thing only. Many people, even those that I already mentioned, people who are working from home or are having their paid or unpaid leave, will have to be laid off at a certain point in time. These changes in your employment status may or very probably will have a severe impact on both your professional and personal life. Of course, there is luckily something that you can do. Unlike the financial crisis almost 12 years ago, the global financial crisis, today there are so many options, guys, for doing remote work. The only question is, are you currently suited to be a remote worker? This is actually a list of the top 10 jobs to work remotely based on a study conducted in 2019. So, email marketer, promotional video maker, freelance writer, web or graphic designer, translator, customer service management, crowdsourcing manager, Android or iPhone developer, ebook publisher, teacher or tutor. These are just 10 of the best jobs that you can do remotely, but there are so many others. Finally, let me say a couple of words that should hopefully lift your spirits. First and foremost, the global economic crisis brought by the recent coronavirus outbreak is not the first and very probably will not be the last one. If you pay close attention, in fact, you will realize that the so-called financial or economic crises in the world are somewhat cyclical. They happen almost every 10 years or so. While the reasons behind each new crisis are different from the previous one, the important thing is that we eventually overcome them. Therefore, instead of focusing on the negative side only, see this as an opportunity to improve yourself, learn a new skill, sign up for a new course, or even for a complete educational program. Just do everything possible to make the best out of these difficult and uncertain times we live in. This is all for today, guys. Thank you once again for watching yet another video on the HRM Academy channel. Do not forget to follow us Facebook, Twitter, LinkedIn, and of course, don't forget to click on the YouTube subscribe button so that you can stay up to date with the latest videos and other educational content that we will have for you in the near and far future.